Men spend billions every year on complicated supplements and tiny blue pills to improve their performance in the bedroom. But one of the most effective tools for blood flow might just be sitting in that mug right next to your keyboard. Looking at this data, we see a stark comparison. Men who consume 2 to 3 cups of coffee daily show roughly a 40% drop in the likelihood of experiencing erectile dysfunction compared to those who drink none. This effect comes from standard everyday coffee, the same brewed beverage found in diners and break rooms for generations. A beverage that costs pennies a cup could be one of the most reliable and widely available tools to support sexual performance. To understand why a morning roast helps, we have to look at the mechanics of an erection. It relies entirely on blood flow. For that to happen, the blood vessels in the penis have to relax and physically widen to let the blood rush in. As you can see in this cross-section of a restricted vessel, millions of men are stuck with the opposite problem. Their blood vessels remain stubbornly tight, creating a physical bottleneck that stops blood from getting where it needs to go. This restriction gets even worse in specific populations. If a man is overweight or dealing with high blood pressure, his vascular system is under constant mechanical stress, making these blockages notoriously difficult for doctors to treat. The central challenge is explaining how a standard morning beverage manages to cut through severe vascular restriction in the very patients that doctors struggle to treat the most. The data for this comes straight from the National Health and Nutrition Examination Survey, a massive epidemiological study that tracked the habits of over 3,700 men. The researchers took a simple approach. They asked participants if they could maintain an erection for satisfying sex, and then they mapped those answers directly against how much coffee the men drank every day. The most striking detail in the results was the demographic breakdown. The men who benefited the most from the coffee intake were the exact populations we just talked about, those who were overweight or had high blood pressure. The numbers firmly establish the connection between regular coffee consumption and better erections. The question now shifts from whether this works to the precise biological trigger making it happen. The active ingredient driving this is caffeine, and it functions primarily as a vasodilator, forcing the muscles in the vessel walls to relax and expand. Caffeine actively removes the internal bottleneck. It opens the floodgates, allowing blood to freely travel into the penis. But because caffeine is a systemic substance circulating through your entire body, its vascular benefits are not confined to male anatomy. Researchers note that this same mechanism, improving blood flow through forced vasodilation, could theoretically increase blood flow to the clitoris, potentially enhancing both arousal and the physical quality of orgasms for women. Coffee is a universal tool for optimizing vascular mechanics across the board. Before you start brewing a whole pot for yourself, we need to look at the limitations of the ENANS data. This study is purely observational, meaning it highlights a strong correlation, but cannot technically prove that coffee directly causes better erections. There is also a severe backfire effect if you push the dosage too high. Excessive caffeine intake triggers bladder irritation, spikes in stress hormones, and severely disrupts your sleep cycle. The irony here is biological. High anxiety and poor sleep are two of the fastest ways to kill an erection, essentially canceling out any vascular benefit the caffeine provided in the first place. 2 to 3 cups a day acts as a helpful, moderate assist, but if you treat it like a miracle cure and overconsume, you will actively destroy the exact physical functions you are trying to improve. Relying on caffeine to force your blood vessels open is ultimately just treating a localized symptom. It completely ignores why your vessels are restricted to begin with. Medical professionals rarely view erectile dysfunction as an isolated sexual issue. Instead, they call it the canary in the coal mine for heart disease. This animated comparison shows exactly why. The blood vessels in the penis are significantly narrower than the coronary arteries feeding the heart. When plaque builds up or mechanical tension restricts your vascular system, those smaller penile arteries will inevitably clog and fail first. A physical failure in the bedroom is often an early warning system, broadcasting that your entire cardiovascular network is under severe distress. The unglamorous reality of long-term erectile health relies on foundational habits: managing your weight, keeping cholesterol in check, reducing chronic stress, and prioritizing deep sleep. Controlling baseline blood pressure remains the fundamental prerequisite for vascular health, outweighing the minor assist provided by a morning coffee. Your erections are ultimately a daily stress test of your vascular system. If you take the steps to protect your heart, you automatically protect your performance.